Good evening and welcome to For the Record. Cervical cancer is the second leading cause of cancer deaths among women in the country. And out of all cancer in women, 45% of women die of cervical cancer. This is a worrying statistic, one that must be examined. And that's why tonight on For the Record, we have two guest experts. The first is Dr. Swaran Naidu, Associate Professor in Obstetrics and Gynecology at the Fiji National University. And second, Dr. Lithia Narumbe, Assistant Professor in Obstetrics and Gynecology at the Fiji National University. Good evening, and it's a pleasure to have you both on the show.
Thank you. It's a pleasure to be here.
So, first up, let's talk about statistics. How prevalent is cervical cancer, and how serious of a threat is it to women in the country? Dr. Swaran.
In statistical terms, we say that we have about 35 to 50 per 100,000 women that are affected by cervical cancer. In real terms, we'd say that per year we probably diagnose anywhere between 120 to 200 women with cervical cancer, and out of those about 60 to 80 die per year from cervical cancer. So for a small country like ours, that's a big number. And also Fiji is amongst, one of the highest rates in the world. Yeah.
Dr. Narumbe, talk to us about how people in Fiji are not necessarily looking at it as a worrying statistics. Of course, we can quote numbers as much as we want, but off camera you have mentioned that cervical cancer is something that is preventable and it is treatable. Why is it that you feel ordinary Fijians, especially women, are not taking it seriously?
Well, I think there are so many competing issues for any woman in the country, and most often our health, the woman's health, is not seen as priority. And so we may know that cervical cancer is killing us and killing lots of us, but to access the care, to say that I'll put everything on hold today and I go and do the screening for myself, to take care of myself or my family, that doesn't happen most of the time.
So you've mentioned that it is preventable, which means that you can detect it in the early stages. Now, cancer generally has 4 stages. When you say early stages, that would be stage 1. Mm-hmm. Tell us, what are the difficulties for those who have cervical cancer in being able to recognize symptoms or signs?
Earlier on, they generally do not have any signs or symptoms. So generally the signs and symptoms tend to be abnormal vaginal bleeding, or bleeding after sexual intercourse, sometimes unusual discharge, and occasionally some pain or discomfort in the pelvis. So these are generally the symptoms, but they can also be quite common symptoms for other things as well. So they tends to be, women don't tend to come in earlier on. Now, by the time women have these symptoms, if they have cervical cancer, it can be quite late. So that is why our drive is so much to get women in when they're well, to come and check, come and screen, come and test, and that's what we want. So all women should be doing that.
One of the very unique things about cervical cancer is that it's preventable, which is rare among cancers. Could you explain how and why it's preventable for someone who perhaps isn't aware or isn't a medical expert?
So cervical cancer is caused 90% of the time, 99% of the time, is caused by the HPV viruses, and certain strains cause cancer more than others. So and to get the HPV virus, it is it is during sexual intercourse, and so we say that for us to protect ourselves for when we have sex, and also when we shouldn't have unprotected sex before marriage, and then also because we can screen. And when we say we can screen, we, like Dr. Swaran was mentioning, we would like to see the women when they have no problems. So there's a screening program where you come in and get, for now we have pap smear and what we call VIA, where we're screening the woman, checking them so that we can catch it before they get the cancer.
So You have told us about what causes the cancer. Of course, there's a couple of stigmas that are associated with it, a couple of barriers. We'll discuss that later on. Let's just look at the cancer itself. Now, of course, you've mentioned in the beginning stages, you cannot tell what the signs and the symptoms are, which is why you need to go for screening. What happens in advanced stages? Does it spread across the body, or does it just sort of stay within the cervix?
So in advanced stages, the mere fact that they advanced is that they have spread from the cervix to the surrounding tissue or to the top of the vagina, and then later on to other structures as well. So yes, it is spread. So when we say advanced cases, yeah.
And we say when we say it's the most second most common cause of cancer deaths among women, why is this? Why does it cause death?
Okay, so first the commonest is breast cancer, and then second is cervical cancer for Fiji. The problem is that when women, we can prevent it was one aspect, then we can also treat the early cases. So if it is caught very early, we can treat it by surgical means. So, and in Fiji, we have only so many treatment modalities. So from that aspect, if they present late, we do not have all the treatment modalities. And even in other countries, in the best of countries, if they present late, there are higher chances of death.
So so it's safe to conclude from that then that if women present earlier or seek medical attention earlier on, or are able to detect it, this statistic would not be as bad as it is.
Definitely, definitely. In countries where they have got good, where women come for screening, they've got good, buy-in into the screening program, they've reduced their cervical cancer rates by 70%. So our neighbors, Australia and New Zealand, have reduced their cervical cancer rates quite considerably over the years. And that's why, it is a shame that most low-income countries around the world, it's not just Fiji, are struggling with this, where women do not tend to access the preventative aspects of care that we have.
We'll be right back after a break. Welcome back. Dr. Lithia, let's talk about the prevalence of cervical cancer in women. At what age does a girl or a female become exposed to the HPV virus?
Well, as we mentioned, the HPV virus is transmitted sexually. And so the girl starts getting exposed to it once they start having sex. And that's the reason that when we introduce the vaccine, it's introduced before they are exposed. So we introduce it to 12 and 13-year-old girls. And in the hope that when they are exposed to it, they're able to fight off the virus, and it doesn't stay there to cause cancerous changes.
So how long does it take for the vaccine to sort of fortify, I suppose, for lack of a better word, the girl's immune system to fight off this HPV virus should they come into contact with it?
Yes, so we hope to get the girls that usually overseas 9 to 13-year-olds. Over here, the class 8 girls are immunized, and so we're hoping by the time they start having sexual intercourse, so about after 5 years.
Mm-hmm.
Yeah.
Dr. Naidu, how long has it been since girls have been receiving this?
This program in Fiji was started in 2012. It was started in Australia, was the pioneering country for it, and it started there much, much earlier. And so they're already producing statistics on how it has reduced the precancerous changes in women as well.
Are we seeing any difference in local statistics?
Not yet. We have got to go through a little longer because 2012 was not so long ago. But in the next 10 years, we should see quite some trends, hopefully.
So a person who is starting to suffer the early stages of cervical cancer, talk to us, tell us how the cancer progresses.
Okay, so the early stages that we are talking about is not yet cancer. So this is what we call precancerous changes, and these in the cells that line the cervix. The cervix is the neck of the womb, so that's exposed to this virus, and then so the cells that line the cervix. Initially, they can be just very minor changes. And sometimes we don't do anything, we just watch it, we don't treat it. But then it goes on to the next stage, which is we say CIN2 or 3, which we call high-grade changes. These are the changes we check with a colposcope, which is like a microscope, and we say, okay, that change is there, we may biopsy it, and if it is there, then we treat it. That treatment is very simple, straightforward, mainly a diet treatment. And remember, this is not yet cancer. And that's what we're trying to pick up. Once the treatment is done, then almost guaranteed that you won't progress to getting cancer later.
Now,
So
of course, to get to that stage, to be able to diagnose and to carry out proper treatment, you need to have screening. Going back to what was mentioned in the first segment, talk to us about screening. You've mentioned that there are various types of screenings that need to be done.
Yes. So historically, we've had Pap smear, Pap smear using a glass slide, and we also have visual inspection using acetic acid, which is a little bit easier, especially for hard to reach places. So we have those two that I have, and liquid-based cytology. Sorry, and now there's also a better one that is to check for the HPV. And usually overseas they do self swabs, and they bring those swabs to their doctors, and then we test for the HPV.
So when you carry out awareness programs and when you encourage women to come up for these screenings, which ones are usually carried out?
it is generally the Pap smear or the VIA, because in Fiji we do not have general access to the HPV testing.
And for women, because I understand that many women out there who are sexually active, most have never been tested even for a simple Pap smear test. How often must they go for Pap smear testing?
Okay, so generally our target population is 30 to 50, 60, 69 it goes up to, but the highest risk is that group. But generally, they can start a few years after they've had intercourse. So if a girl starts very early having sexual intercourse, they probably need to start a bit earlier because their exposure is earlier. After that, they can have it every 3 to 5 years. So, yeah.
Could you tell us some statistics, share with us how many women on average do get these screenings done? How many don't? Would you have any numbers?
We have got, I think in Fiji, unfortunately, we probably have 10%. It may have increased to 10 to 15% because of VIA. And I think we've got some pockets of very good response from the VIA. So the population that needs to be screened, we are very low in the number that actually are getting screened.
So you're saying that only 10 to 15% of women out there who are sexually active are actually getting themselves screened for Pap smear tests. That's a very worrying number, and of course we need to explore reasons why they are not coming forward in this day and age when you have free medical health services available. Then they should be stepping up. You've conducted awareness programs in rural areas. Talk to us about that. Women out there, are they forthcoming? Do they come up and talk to you about reproductive health issues, coming for testing, coming for screening?
Yeah, I'll speak for the indigenous women. I think there's lots of myths that go around the communities and also just, we're shy because we're shy to come to a stranger and to conduct such a sensitive examination. And also sometimes we prefer not to know. And so they just stay at home and prefer not to know what is wrong with them, and we blame. And we have lots of stories that go around the villages, blaming all the wrong things for the sicknesses. And because of that, because of lots of cultural issues and just social, determinants of health where they can't come because of they're saving their money for something else. So so they are unable to access this. Yeah.
Is
the
that the
person.
same for, before we cut to break up, is that the same for women of Indian descent in Fiji?
I think there's several things that are common, and so yes, but I think overall we do know that health-seeking behavior is maybe a bit better amongst the Indian descents here, but we still have late presentations of cancer even amongst them as well, and most of our screening is done opportunistically. So when they're there for something, we ask them and do it, and that's why the numbers are the way they are. We do have some programs. We do have zone nurses that try to do in their own areas as well. So yeah, but what Dr. Lithia was saying, yes, we do have a higher burden of disease amongst the indigenous population, which is very concerning for us, and also the age of late presentation is earlier, as well as the burden of mortality or death is a bit higher amongst the indigenous population.
We'll have more for you right after the break. Welcome back. Dr. Naidu, for someone who may feel a bit hesitant to get screening done, what's the procedure for when someone goes to a health clinic and they ask for a screening to get done? So from beginning to end, what happens?
Okay, so they can talk to a nurse and say that they are here they want to screen for the cervical cancer screening thing, and it is actually quite simple. It seems daunting, but it is not all that daunting once you present yourself. And if the nurse is somebody who does the cervical cancer screening, she will do it herself. So she will take her into a room and in privacy usually. I think most of us women have had children, etc. So they should, there is a certain level of hopefully comfort in knowing that gynecological examinations get done. So in privacy, they have this test where a speculum is put inside them, and then a very simple brush is used to take the smear from around the cervix. This process is not actually painful. It is uncomfortable because you're having this, but it doesn't take more than a minute or two to actually have it done. And then the sample of cells that are taken is just put into the liquid that we have, or onto a slide depending on what they have, and sprayed, and it goes to the lab. And then the other one so that's pap smear I described. The other one is VIA, or visual inspection of cervix, and after putting some acetic acid, which is like diluted vinegar actually. So we dab some onto the cervix. After putting speculum in, we look and we dab some onto the cervix. It may change color, and we see the changes that are there then. And if required, sometimes they get treated at the same time.
And how long does this procedure take?
5 minutes.
5 minutes. So it's a relatively short and simple, relatively non-invasive, painless procedure.
And women would get up and go from there and can continue doing normal work. If you've come from work, you go back to work. If you've come from home, you've got children, they can go with you. It's not anything.
And is the procedure always carried out by a female nurse? What if someone goes and they express a preference for a female to carry out the procedure? Will that be accommodated?
Yes, of course. If it's possible, not like on an island and there's only the male nurse that's there. So if it's possible, yes, we would.
There's also some sort of a stigma that is attached to it, which is obviously a battle that all medical health professionals face every time you conduct awareness programs. Now, of course, you've mentioned that the major cause is the HPV virus, which is transmitted only through sexual intercourse. Now, just because someone may contract it does not necessarily mean that they are promiscuous. If someone has an encounter with just one sexual partner, they're still in danger of this.
Does your risk of contracting cervical cancer increase with sexual activity?
Yes, having sex is kind of almost a prerequisite for acquiring this virus. But you could be you could have one sex partner throughout your life, you could still have cervical cancer. Yeah. But obviously, if you have exposed yourself more, then it may increase your risk. But essentially, the message is it's not as if women cannot get it. All of us, about 70-80% of us have been exposed to this virus. And the point is that some of us are able to get rid of it naturally. It just happens with our immune system. But with others, it may linger on. But there's no way to tell who has it and who doesn't have it until you go and have the test. So in answer to your question, a woman could have had only one sex partner throughout her life and still get this.
Let's look at dispelling a few myths around this. There's, of course, one that we've just debunked, which is the fact that if one has multiple partners, that's the only way that you can get it. Let's look at the fact that a lot of women start considering, if I go to get myself tested, then that means that there's something definitely wrong with me. They do not consider that just to get yourself checked means just to get an update on whether or not you're 100% healthy. Tell us more, doctor.
Yes, our culture sometimes dictates, into how we seek health or healthcare, how we access it. So for most times, the Fijian woman doesn't really think that she should go and check because there's nothing wrong with me. Yeah, and as we have said, we want to check you when there's nothing wrong with you. We want to pick it up before it becomes cancerous, because then the treatment is much easier. Yeah, and it's done here in the country. So most often, sometimes we see that we diagnose women and then they get very scared. Yeah, and maybe it's because of the stigma that you say that the community might think she's got cervical cancer because she's been promiscuous, and so serves her right. Yeah, and so she sits at home and doesn't access the help that's needed, and then she only comes when it's really, really late, and we can't do anything.
And in fact, that's something that's common not only for women but even for men. Generally, for sexual reproductive health, even for prostate cancer testing. So the idea is you don't go to a doctor unless and until there's something wrong with you. Would you like to see more work done to sort of dispel that belief?
Absolutely. We really, really need to raise the awareness in our communities everywhere, wherever possible. The very word screening means you are doing it before there is a problem. So it's not waiting for a symptom. It's not waiting for a sign. It must be like, second nature, that I will go and check every so often, or I will go and once every 3 years or so, I will go and check. I'll make sure that I don't, have my pap smear or have a VIA here in Fiji. And I think that's the only way to try to get rid of this problem. And in other countries where they have got a higher engagement into the programs, they have reduced their cervical cancer rates considerably. So
We'll have more for you right after the break.
Welcome back. Dr. Swaran, let's look at some other few things before we actually move on to what the Ministry of Health is doing and also what academics are doing when it comes to cervical cancer. There seems to be an air of distrust and also a little bit of fear when it comes to going for even awareness sessions. Now, we have spoken to the everyday, Jane and Joe out there on the road, and they have mentioned that in rural communities, because it's so close and tight-knit, they don't want to be seen to be associated with anything that may be a little scary. With cervical cancer, of course, mortality rates go up very quickly in late detection. If you go out and you carry out cervical cancer awareness programs and you go for screenings, have you noticed that there is a drop in the number of women that actually come forward?
It's been a problem for most of the time. It's not as if there's been a drop or anything like that. It's just that what you don't fully understand, it's hard to get your mind around and to come to. We actually did a research amongst rural women, and we found that majority of women had not heard of cervical cancer or did not know what it was about. So what you don't know, you don't come out to have done. And whilst you're feeling, well, why would, you feel as though, why should I go and do something about it when I'm feeling fine? So what we are here to say today is, it is when you are feeling fine. I mean, I could be sitting here like that, or any three of us could be sitting here like that. If we haven't tested, we could look all nice and healthy, but we could still be harboring it and not know until we go and test. So
they have also stated that they have this belief that it's hereditary, and that it's not just through sexual intercourse. They think that, oh, my family's never had any sort of cancer before, therefore my immune system is super and I'm never going to get to it. That, of course, is a myth, correct?
Yes, it's a myth. It's not a hereditary cancer. This one is not the one that we're talking about. It is through this virus that we are saying. I just want to say one other thing. It isn't that this thing about sexual intercourse. Somebody could have had sex just once, but got the virus and isn't having sex at all for the next 5 or 7 years, but she can still get the changes. Okay,
So it's
yeah, a widowed woman, somebody who's had menopause. These are some of the myths. They think that I shouldn't have the test because I'm widowed. So from that point of view, it's the virus that we're concentrating on, and that's what we are trying to talk about. And unlike a bacteria, you can give antibiotics and get rid of it. A virus, you cannot do that. There is nothing that you can give to treat it. So for that reason, it lingers on in your system until or unless your immune system gets rid of it. Yeah.
So let's examine, in fact, while we're on the subject of treatment, let's examine treatment a bit more. So suppose someone has cervical cancer that has progressed to a cancerous stage. What then needs to happen to ensure that it doesn't ultimately end in a death?
Okay, so ideally we want to catch it precancerous. When the lesion is not yet cancer, but after that, if we need to catch it and be able to do something, then we need it to catch it when it's really early. So stage 1, stage 2 cancer, so that we can do surgery locally within the country and be able to treat it. Otherwise, anything after that, then we need to refer the woman overseas for radiotherapy.
Again,
So
when
once
you
it's
say
once it's progressed to a cancerous stage, surgery becomes necessary.
Absolutely, the early stages.
Okay.
so while we're still talking about treatment, we're very fond of trying to use herbal medicines, trying to stay away from the doctors, not wanting to go to get tested anymore. You don't want to go and have surgery, maybe because of personal fears. Do you think that it should be encouraged or discouraged? Is it complementary to medicine that is prescribed by health officials?
The herbal medications are not going to help in this situation. I mean, there is, and this is the way it is. There will be changes if the virus persists. There will be changes in the cells, which unfortunately no herbal medication that we know of will treat that. So the only way to, if it is there, is that we have to treat it by the conventional medical therapies that we have. So unfortunately, no, there's no herbal treatment that would be even complementary, like to what we are doing.
And since you're both academics from FNU, from an academic point of view, is more research being done or being invested into this area?
We've had a couple of researches done. One was done at CWM by Dr. Nanise, where she looked at what happened, how many cancers they had, and the outcomes, and which group had more, the stages they present, and all that sort of thing. So that was that gave us some very useful information. And some of the information was that 70% of the cases were amongst ETOK, and the higher disease the burden of death was amongst Ethiopians as well. That's not to say the Fiji Indians and the others don't get it, they get it as well. And so that was one thing. Unfortunately, she also found that after the diagnosis of cancer and when they recalled for treatment, a good proportion of them do not come for the treatment. And that is really, really sad. So they, you know, go away and try those other things that you were talking about.
And what reason could you theorize for women not wanting to seek later treatment for that?
I think most of the time they are, I mean, for the indigenous women, she's trying the herbal, yeah, and trying to pray, and then just waiting at home. And what we're saying is, yes, let's all pray.
And hope that it goes
Let's
away.
all pray, but come, because we're also praying, and
Yeah.
we want to fix it, and for them to be able to go back and look after their families.
Let's look at just one other aspect. Well, the moment one is diagnosed with any sort of disease, you need support from, of course, the core, which is your family, husband, wife, children, family that's surrounding you. Do you see that the women who are diagnosed with cervical cancer have a lot of backlash that they receive from their loved ones?
Perhaps they're isolated.
Not really. No, I don't think so. I think our communities are wonderful in that way. They tend to rally around people who are unwell and try and help each other. So not in my experience, I don't think they have a backlash just because they've been diagnosed.
Yeah, our community is very good at showing compassion when the lady has got full-blown cancer. And what we are pleading is, can we also do it before it gets full-blown? Yes.
We'll have more for you in our final segment right after the break. Welcome back. Dr. Nurumbe, suppose someone who is suffering from cervical cancer wishes to seek out specialist help on their own. Who's the right person to go and see?
Okay, right now for cervical cancer, it is available in all the divisional hospitals, the 3 divisional hospitals. So the gynecology, the ONG unit, obstetrics and gynecology unit, they are ready for these patients for the whole process, I guess. And then for them to come to, usually they come into our clinics, and then once we diagnose them, they are then, there's a family conference where we're talking to the family to get the family support and for everyone to know what is actually happening. And then if it's early stages, then surgery is booked. Yep, surgery is booked as soon as possible once we know the diagnosis and the staging, and that is done here in Fiji. If it is a later stage and surgery cannot be done, then we're referring them overseas for radiotherapy.
And Dr. Nadu, what's the extent of the work that the School of Medicine, FNU School of Medicine, does with the Ministry of Health, especially in relation to cervical cancer?
Okay, so I guess FNU has got several roles. First in training the nurses, then training the doctors, and so these are the people who go out in the field and do most of this work, both in preventative aspects as well as the curative and treatment aspects, not only for Fiji but for the whole of the Pacific actually. And then also they have had some screening programs that was conducted across from Suva to Lautoka last year, and they helped with the screening within the campuses as well. And Lithia, you were involved with that as well, weren't you?
Yes, there's a staff screening program that was started last year within FNU to cover all the FNU campuses, offered to all the staff. So I guess apart from training the health workers within Fiji and in the region, and also research, then we also have to take care of ourselves and do our own screening.
So,
Also, I run quite an extensive outreach program in the West where we are doing outreach, awareness raising, education, training of community health workers, helping train nurses, as well as train women's advocates to go and spread the word into the communities, and as well as doing screening in the communities as well.
Does the Ministry of Health have teams willing to assist corporate entities or perhaps government sectors that want to have their staff screened? So let's say, for example, if at FBC we wanted to have a screening for all the females in our office, would we be able to get a team from the Ministry of Health?
Yep.
Yes, I think that's easily done, and that's being done already. And usually they call into either the health center that's nearest to the place, or to Oxfam Clinic, which is now called the Women's Wellness Clinic in CWM, and they arrange and coordinate.
And
in other areas also, Fiji has a very good infrastructure of kind of how this public health aspect works. So the subdivisions, and they have zone nurses, and they have their catchment areas, and within those areas the ministry requires them to do certain number of screening, go to the communities, do that, as well as if an organization or business community is within a particular area, they can request the local subdivisional health sister or the medical officer, and they'll organize those outreaches to do the.
But it's just a matter of incentive, and
that's
person
right.
wanting.
That's right, and it can be done.
So, Dr. Naidu, before we wrap up, just a question for ladies who have never had any testing done. Is there an optimum time for them to come for testing, or can they come at any point in time?
I think around the country there'll be various different times. I think apart from the weekend, if they try to seek out assistance, find out where they can go and have this done, it will be, quite readily available to them. So long as, most of our women know that they have a zone nurse or a health center or a nursing station or a main hospital or subdivisional hospital or the hospital. And then there's, as Lithia has mentioned, the Oxfam clinic here or the Women's Wellness Clinic here in Suva. Lautoka also has the hub center and the Lautoka Health Center. So there are many health centers that are around where this service can be provided for them of the screening
and of course,
aspect.
confidentiality is assured.
Absolutely. I mean, and I think a woman has the right, if she feels as though her confidentiality is not fully covered, then she can ask for that. She can say, can I please be alone, or can I, is it possible to have, as you had asked me us earlier about asking for a female, they can ask for it. It might not always be possible, but people will try and make an attempt. Having said that, I must say that we have very compassionate and caring male doctors and male nurses as well, who are very good with these things, and often we have males doing deliveries as well, so I'm sure women can.
So on that note, I think that was a message enough for women to listen, and if they haven't done their screening yet, they can always come to their nearest health clinic or hospital. We thank you both for joining us to discuss this very critical issue. Thank you for coming on the show.
Thank you very much for having us.
And that's all we have for you tonight. Join us again next week. Good evening.